I'm referring to the giant salmon, Faraj.
Okay, from the land of the dinosaurs. So sorry if you see me playing with my phone. It's because in my quest to go completely digital, I am down to one screen that I can barely read, and I realized this just now. So you'll have to bear with me. So continuing on the WISE analysis provided by Stella and by our conveners. I want to tell you a tale of an implementation that I've been following in a city up north, and where there are some really advanced hospitals who are very excited about the new and AI. And it's a study that I'm doing with the PhD student Anand Bardwaj, who unfortunately could not get a visa to get here. So I'll do the job, but it's a joint project. So two important hospitals struggling with meeting the needs of the population, and at the time of COVID, and already with large queues for surgery and almost all essential services, meet a provincial ecosystem where AI is a hot topic, where the federal government and the provincial government have thrown in almost $300 million to create what they call a super cluster in terms of innovation, focused on AI, because Montreal is a town that should be known or is known for AI. So these two things meet, and projects are born as a result. And so both hospitals, and one is French-speaking, one is English-speaking, they decided to launch an AI project to help with a very complex problem, the problem of scheduling of the OR. And if you know anything about hospitals, the scheduling of ORs is a very thorny problem. Surgeons often underestimate the time it takes to do a surgery, and the anesthesiologists don't want to stay extra hours. The nurses want their breaks, and patients sometimes have things happen to them. They catch COVID, they do things, and so it's a very complex coordination problem. So in that environment, scheduling the OR rooms, and some of them are less in demand than others. Some have features that make them feasible for one type of surgery versus others. It's very artful. It's a very artful form of coordination. So AI is perfect for solving that problem, right? So let's throw AI on it. So these hundreds of millions of dollars that got invested have to make it into the economy and turn Montreal into a giant in AI. And so money is available for projects like this. Both hospitals went and got the money, and we have these two projects happening at once. So we get in the field, and we have been looking at how that's implemented. And we discover things like that basically OR scheduling is done by three heroic people, and for me, they're heroes that sit in a very small room, almost like a cubby hole next to the bathroom, and they have 2-3 screens open, and they have cell phones, and they have a lot of charts and paper, and they are doing their magic, calling patients, trying to move things around, telling Dr. X that we know your surgery takes 6 hours, you cannot schedule 2 of them in an 8-hour shift, things like that, and negotiate all this. So comes the AI development team, and they are like, where's the data so we can run our model? And so they get their hand on a data dump from all the systems in the hospital, and they run through these literally thousands of variables and come up with a list of 8 essential variables that are going to be predictive for scheduling the OR. Now, the question is, what could go wrong, right? And the story is not over. This is where it's at, but I can already tell you that the system will not learn, as we were told that AI, one of the features of AI is a learning system. It learns from its own data. This system, due to the choice of the developers, will not learn after it's implemented. So there's no feedback loop after it's implemented. So it's going to be based on historic multi-year data. So that's the first thing that will go wrong. right? And then secondly, the job that is being done by these people who coordinate the OR cannot be duplicated through the variables of the system. The variables do not represent what they do. There's a lot of judgment calls. There's a lot of talking to Mrs. Smith and realizing that she has some additional comorbidity that wasn't in the data, or some issue, or she just fell over and hurt something that wasn't there and wasn't reported. So you can see that there's going to be an issue with that. So the tool will probably be called a success by the developer. The hospital leaders will crow about how they're doing amazing stuff with AI in the hospital. The supercluster and the people all the way to Ottawa will claim amazing success in terms of implementing AI. And the actual people doing the work will probably tell you a very different story. The story is not told yet, but you can easily predict certain outcomes. So the question for us is, are we reinventing the wheel by pretending that AI is so different that all the lessons from software development in the past are thrown out the window and not being applied here? Are there things that should be done that are more kind of traditional and boring and visible, like getting the right requirements, figuring out what exactly is going on in setting, things of that nature? And then, given that hype, one of the, it's not a question, it's more of an answer. I would say we need a lot more field work, in-depth processual following the development and the technology and the users to really understand what's going on. Talking about AI in healthcare at a very high level is useless, I'm sorry to say. Thank you.